Hi, I'm about to start a implant surgery. My patient's tooth number 8 fractured off at the gum level beyond repair. So we decided to do extract the tooth and restore the area with an implant retained restoration. The endodontic already done on that tooth, but however it didn't survive. So we're just about to start the implant surgery now, okay? Here's the tooth. Let me the light. Here's the tooth, which is number 8. And as number 8 is actually located in the aesthetic zone, what is called aesthetic zone. So we have to be very, very careful when you are removing this tooth, because one thing you don't want to do is break any socket bones, particularly the buccal or the facial socket bone, because the facial bone is very important in future, not only the future of the implant but also achieving a good aesthetic result. You want to preserve that bone as much as possible. Now the tooth is out almost. Here it is coming out. Tooth is out. And now I'm debriding the walls, debriding and as well as rinsing the socket. If there is any granulation tissue, you want to make sure that's removed. Since this is an immediate implant, which is you extracting the tooth and placing an implant immediately. In this kind of cases, it's very, very important to debride the socket of any granulation tissue or periodontal ligament, which may become reason for implant failure in future. So you have to thoroughly debride the socket and rinse it. I'm getting ready to do the osteotomy now. Here I'm doing osteotomy with pilot drill and a series of other drills for the osteotomy. I'm getting ready to place the implant now. The implant is placed, but it has to be inserted further up apically. So I'll be using it manually. I'll be torquing it manually. The other thing that you have to be very, very careful, especially in the aesthetic zone area or any area for that matter, because the angulation of the implant is very important uh, for the future success. Let me have the mirror. Here it is, the implant is placed, as you can see. Placing the cover screw here. Later on, I'll remove that cover screw to provisionalize the implant. And now I'm gonna place the bone graft, the particulate allograft, around this implant in the spaces between the implant and the wall of the socket. I'm placing bone graft. I'm going to be using a periodontal probe to insert or push the particulate bone and the spaces around the implant. I'm making sure that the bone graft, particulate bone graft, is tightly stuffed in the space. And now I'm placing a small membrane with a small central hole through which I will be inserting the provisional. Placing the membrane. I've just placed the provisional now, and I'm making sure the access to the screw is restored with a cotton pellet inside and with a flowable composite. One thing you want to make sure when it comes to implant provisional, they are not touching the opposing teeth. They're completely out of occlusion, because if they are occluding with the lower, if you're loading these immediate implants, then they are gonna fail, sure to fail. I'm restoring the access now with the flowable composite. I'm actually gonna bond the provisional with the adjacent tooth, and that will provide the stability that you need for the success of the implant. You want to make sure that there is no movement with the provisional. The implant is temporized now, and I'm gonna refine the shape of the crown, the temporary crown, and also make it sure that it is completely out of occlusion. I'm refining the shape of the provisional. Here I'm checking the occlusion right now. Look at that. That's the finished version of the provisional. The implant is restored with a provisional or a temporary crown. The patient came with no tooth, and we're sending home with an implant and a provisional or a temporary tooth. I hope you enjoyed this short implant placement demonstration, and I will be presenting you the final perhaps 2 or 3 months later. Hope to see you there again, and I also want to request all of you to subscribe to this channel, and also don't forget to click the notification button so that you will get the regular updates, all the videos that I will be posting in future. Thank you for watching.